Hello, Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome back to my channel. This is Dr. Sana. Let's look into today's topic. Today we are taking the continuation of the previous video, knowing about your vulva. Okay, so let's look into the normal vulvar variations or healthy changes in vulva. Number one is color variation: pink, brown, dark brown or purplish tones. Darker color compared to the surrounding skin. Color may change during pregnancy or arousal. These all color changes are normal. Do not require any treatment. Okay. Next point is labia size differences. Some labia minora may protrude outside the labia majora. One side may be larger than the other side. These all size variations are normal. Now let's look into the next point. Mild moisture or discharge. Normal vaginal discharge may be clear, milky white or white, slightly sticky, slightly stretchy around ovulation time. It usually has no odor or some mild odor is there. That's all normal. Mild odor, the odor of the vaginal discharge. A slight natural odor is normal due to sweat glands and vaginal bacteria. That's really normal, not to worry about. Temporary swelling that can occur with sexual arousal, hormonal changes, and physical activity. It's also normal. Now let's look into vulvar infections. Let's look into the point which should be noted. One is intense itching, common with the yeast infection, allergic reactions, and skin disorders. Second point is abnormal discharge. Warning signs of abnormal discharge include cottage cheese like discharge, which is usually present in yeast infections. Grey thin discharge with a fishy smell, usually present with a bacterial imbalance. Yellow or green colored discharge, possible with sexually transmitted infections. Now, let's look into next point. Strong unpleasant odor. A strong fishy or foul smell usually indicates infections. Now let's look into the next point. Pain or burning sensation. Burning sensation during urination, pain during sexual intercourse, persistent vulvar soreness, these are all abnormal. You should note and seek the attention from the medical professional. Now let's look into the next point. Redness or severe swelling. It is the sign of inflammation or infection. Now let's come to the next point. Sores, ulcers, blisters. These may occur with viral infections and severe skin diseases. Now the next point. Lumps or painful swelling could indicate blocked glands or cysts. Let's look into a quick comparison. Color features, normal variations, and possible infection. Color pink, brown, and dark. Possible infections are bright red. Discharge clear or milky is the normal variation. Thick, green, gray. If it is foul smelling, it is possible infection. Odor, mild natural scent is normal variation. Strong fishy or foul odor is the infection. Itching, usually absent. Persistent itching is the sign of infection, and pain, usually none. Burning or painful is the possible sign of infection. Important point you should keep in mind that seek medical evaluation if the symptoms persist more than a few days, worsen or are accompanied by pain, fever, unusual discharge or sores. Now let's look into the proper vulvar hygiene. You all know that this is our vulva. Let's look into the proper hygiene that we should follow in our life. Okay, let's go. Proper vulvar hygiene helps to maintain natural balance of the skin and protective bacteria. Doctors generally recommend gentle care because the vulva is the most sensitive part and it is where easily get irritated. Recommended vulvar hygiene practices are wash with warm water, clean the vulva once daily during showering or bathing. Use lukewarm water and gently rinse the external genital area. Second point is use mild unscented soap. The use of unscented soap is really optional. If the soap is used, choose fragrance free gentle soap. Apply only to the outer area, that is labia majora. If the area where the hairs are grown, you should apply soap only over here, the area where hairs are grown, the outer lip of the vulva, where only you should apply the soap. You should not apply the soap beyond this point, okay? Let's come to the next important point, clean front to back. If you are wiping, clean from front area to the back area. It should be always wiped from front area to the back area. It prevents the bacteria from the anus reaching to the vulva. Okay. Now let's come to the next point, wear breathable underwears. Next point is change wet clothing quickly after exercise, swimming, swearing. Change the clothes promptly to avoid moisture buildup. Okay. Now next point is maintain menstrual hygiene. Change pads or tampons every 4 to 6 hours. Menstrual cups should be cleaned according to the instructions. The next point is keep the area dry. Pat the vulva gently after bathing or showering. Avoid rubbing harshly with the towel. Okay. Now let's look into the point what doctors recommend to avoid. One is douching. What is douching and how is the douching done? These are all I'm going to explain in the next video, okay? So, one is douching. Douching disturbs the natural vaginal bacteria. It increases the risk of infections and irritation. Now, next recommended to avoid scented products. Avoid perfumed soaps, feminine sprays, scented wipes, deodorant sprays, etc. over that area. These can cause allergic reactions and itching in that area. Now, let's come to the third point, harsh scrubbing. Avoid harsh scrubbing. The vulva has a delicate skin. Scrubbing can cause micro injuries and irritation. Okay. Fourth point is tight synthetic clothing. You should avoid very tight clothes and non-breathable fabrics. It can trap the heat and moisture over there, increase the risk of fungal infections. Okay. Next, another important point is talcum powder or perfumed powders. These can irritate the vulva and are not medically recommended. Now, next point is frequent use of panty liners. Constant use can increase the moisture and cause irritation. Okay. Now let's look into the important medical advice. The vagina cleans itself naturally through normal discharge. Therefore, internal cleaning is unnecessary and harmful. Only external genital area vulva should be cleaned. Now let's look into the point when you should seek a medical advice. Seek a medical advice if you notice persistent itching, unusual discharge, strong odor, pain or sores. These may indicate infection or skin conditions. Okay, so that's all about today's video. Thanks for watching. Assalamu alaikum wa rahmatullahi wa barakatuh.